A lot of BDS students think that prosthodontics is all about crown and bridge, dentures, and some amount of restorative implants. But there is more options which are available after you're doing your masters in prosthodontics. And to talk about that, today we have with us Dr. Reiyal. Dr. Reiyal completed his BDS from Yerla Dental College and Hospital. He then went on to do his diploma in oral oncology and radiation biology from Mahidol University, followed by which he did his MSc in maxillofacial prosthetics. He did not stop there. He went on to do his fellowship on maxillofacial prosthetics from Mahidol University. He then worked there as a clinical instructor in the same field. After which he came down to India. He set up his private practice in South Mumbai, focusing on implants, intraoral and extraoral prosthetics. He has been actively teaching extraoral prosthetic fabrication since 2016. He is the founder of Sarvasa Healthcare Services, a multi-speciality service providing complete services and rehabilitation to cancer victims. I am Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Reiyal. Thank you for taking your time and joining us today.
Thank you, Dr. Satish. It's an absolute pleasure. Thank you.
Thank you. Thanks a lot. So my first question is, a lot of people who get into prosto think that prosto is all about, or prosthodontics is all about crown and bridge, dentures, and maximum implant restorations. Okay. But you're doing something different. So my first question, before even we begin about your specific niche, what are the various opportunities for someone who is done masters in prosthodontics?
Okay, great. So when basically you pass out from prosthodontics, you, like you've just already mentioned, you already have gotten certain exposure to implant dentistry, you've gotten crown and bridge dentistry done, you've gotten complete dentures and also cast partial dentures. Okay, so that also is, so what I would advise students to do is to look into what they really enjoy in those few fields, and then they can take that further. So then you can always specialize further into implant dentistry. Okay, in pros, a lot of it is mostly done only from the prosthetic angle. Okay, now also surgery is becoming a new thing where everything should be prosthetically driven. So you already have the advantage that you know exactly how a crown is supposed to look, where it's supposed to go in the mouth. So you already have that advantage. You can fine tune your skills on the surgical aspect. So that will sort of complete your entire journey in implant dentistry. Along with that also, then you have orofacial pain, okay, that deals with the TMJ. So that's TMJ especially, so then you can call yourself a TMJ specialist. You can also delve more into full mouth rehabilitation. You can go more and more into that and then just, you know, purely do full mouth rehab cases, which is also a great option. And then, of course, you have something what I do, which is known as maxillofacial prosthodontics.
Understood. So there are a lot of options, like you told, the prosthodontics, and people should not just put them into a small bracket saying, I do not have a lot of scope after prosto. Thank you for enumerating them. The next part is, when you're talking about oral and maxillofacial prosthodontist, okay, what is the range of cases that can be treated? Can we treat most of the cases in all complicated procedures as well?
Okay. So first of all, I'll just enlighten what is maxillofacial prosthodontics and prosthetics. Okay, so it basically deals with the reconstruction and rehabilitation of patients who have any defects, either from trauma or from or a congenital defect. Okay, so that means birth defects or trauma. In our country, the most amount of trauma that the patient undergoes is coming from cancer. Okay, because oral cancer is one of the largest, is the most prevalent cancer in our country. So maxillofacial prosthodontics is actually even known as bullet. When you become a maxillofacial prosthodontist, you're called a bulletproof dentist. Okay, that's what we are sort of known as, because the kind of complications that you are able to handle after you've got a feel of maxillofacial prosthetics and prosthodontics is immense. Okay, so when you're talking about what kind of cases do you deal with, so it's usually dealt with any kind of trauma, intraorally or extraorally. For the intraoral aspect, when it comes to, I'll go mostly towards the cancer route. So when a portion of the mandible or a portion of the maxilla or even the entire mandible or maxilla is removed, how can you restore that? Okay, so that is going to be your majority, the bulk work that a maxillofacial prosthodontist does. Extra orally, we also can do a lot of anything to do with the face, restoring any part of the face. So it deals with eyes, ears, noses, mid-facial prosthetics or bital prosthetics. That's basically not just the eye, but even the muscles around the eye. We can replace that. This is all done using silicone. So it's not going to be so much of a functional benefit to the patient, like they obviously can't see through the eye, the ocular prosthesis you give, but it definitely gives them an immense boost in terms of confidence. They feel like a whole person again. So that aspect is something that you can completely fulfill as a maxillofacial prosthodontist.
You have told me you deal with the entire face basically. But
Mhm,
now the problem with face, there are a lot of
mhm,
claimants to it. You have oral
mhm,
surgeons who claim it, the dermats do
mhm.
claim it. There are a lot
Right.
of people from medical and dental
Mhm,
faculties who think they
mhm.
are the ones who treat those areas.
Right.
So how does oral and maxillofacial prosthodontics integrate with
Mhm.
various dental and medical fields?
Okay. So now when you said that even they feel that they are able to take care of this, I agree with you. But a surgeon will only do it from a surgical aspect. More or less, they will tend to mostly remove something. A plastic surgeon will tend to put it back. The dermat deals mostly with the skin and issues with the skin or hair. Okay. Whereas what we do is something that you have a complete defect, as in that part does not exist. Okay. That gets replaced by a maxillofacial prosthetist. Okay. I say prosthetist now because you are not, it's not a dentist anymore. You're not dealing with the mouth, you're dealing with a prosthesis that you're doing for the face. All right. So
Understood.
how do we, so how would we integrate with them? I would say you need to be a part of a team. So what I have basically formed over here, something known as Sarvasva Health, where we basically are a team of about 15 doctors. Okay.
Great.
And this is all cancer related. Okay. But we also have trauma surgeons on board. And why is this important is because when you're a part of this sort of team, it's not only the surgeons who take part in it, but also the surgery is prosthetically driven. And you bring that flavor to that entire team. Because what happens otherwise is that the surgeons will go ahead and they will do a surgery. Okay, they will put in, they will replace whatever is missing. But sometimes if they're doing a graft, for example, so the most common workhorse that we are using right now is known as a fibula graft. So when a portion of the mandible is removed, you take the fibula out from the leg, it is designed in a particular manner and it is put into the mouth. How it is supposed to be designed, ideally, should be in such a way that you can rehabilitate the patient later. It is not just the fact that they've put the fibula graft in the mouth and that's done. Because then the patient just has this piece of bone in his mouth. He doesn't have teeth over it. So that technically you've not done complete justice to the patient. Even when you're doing any sort of surgery, resective surgeries, you should be able to guide the surgeon as to how much he's supposed to remove so that you can put in a prosthesis later to complete the case. So how we integrate is both pre-surgical and post-surgical. So in terms of a cancer patient, for example, if it's pre-surgical work, any teeth that need to be extracted, any teeth that require root canals, any sort of gum surgery that's required to be done if a patient has very poor oral hygiene, all these things will get done and you will help dictate as to what is to be kept, what is to remove, because you will be the one who's giving the final prosthesis. So that's how you can integrate with the dental faculties there. And it gets very interesting when you come to the surgical aspect, because now you're working with your resective oncosurgeons and your plastic surgeons. So you will be the one who actually is supposed to plan the case along with them as to determine where the margins of resection, as in where they're supposed to cut the bone, how much of the bone they're supposed to cut. Is the plastic surgeon going to be able to replace that? All of that should be done as a table discussion between the three of y'all, with you, with the maxillofacial prosthodontist actually guiding the surgeons as to this is what should be done. So you play an integral part of that team. Once that's
Understood.
also done, the patient then goes ahead for rehab. Okay, after the chemotherapy and radiation, so on. So in the rehab, you will deal very closely with a speech and swallow therapist. You will be dealing with a physiotherapist. So making devices for the patient who has poor mouth opening. So that's where a little bit of your TMD will also come into play. You'll be dealing with a speech therapist. So there is where you'll be making speech aid prosthetics for the patient so that they can eat and swallow and speak properly. So basically your role in an entire cancer team is pivotal to getting very good outcomes. So it's very important.
Understood. So you're telling that this entire thing is integrated together, okay? But
Mhm,
as an individual, are there
mhm,
or is there a requirement of a large number of oral and maxillofacial prosthodontists or
mhm,
prosthetists, as you call them,
mhm,
or there is
mhm,
sufficient amount of them? My basic question is there
mhm.
scope for a newcomer?
Absolutely, because right now, from a trained maxillofacial prosthodontist view, there are only a handful of us in the country. I'm
Oh,
talking about who have been specifically trained for maxillofacial prosthetics and prosthodontics, not those who claim that they do this. Okay, there's a big
understood.
difference. All right, so those who have actually been trained were just a handful. And I've told you that in India, oral cancer is one of the largest cancers, most prevalent cancers there. So you can just think about the scope. It is immense, and there's a huge need for maxillofacial prosthodontists as specialists.
Understood. But in tier one cities, okay, patients would be willing to pay and go ahead with this. Do
Mhm.
you think similar scope is for someone who plans to set up a practice or work in a tier two or a tier three or a rural area? Even if you're getting 1 point from this video, before you listen to the answer to that question, do not forget to hit the like button below because the guest has taken time to come and tell you about this option after BDS. And I'm sure to subscribe to our channel if you want to take your career to the next level.
I think they will do way better than the ones who are actually in tier one cities. For the reason being that all the patients who actually have cancer are coming from tier two and tier three cities to tier one cities to get treated. So if you are actually based over there, there are onco centers that are present in those cities as well. And if you can develop a maxillofacial rehab center in those cities, you'll be doing a great service.
Understood.
It'll
But
be
is there
you'll actually get more success, I feel, in tier two and tier three cities than actually coming to a Mumbai or a Delhi or a Bangalore, for example.
a financial return to it if I'm working in a tier two or tier three city? How do the
It's
patients pay
always
for
it's
it from
always
rural
it's
areas?
always about money, no? It's always about
Yes.
the money. Yeah,
Because a lot of
absolutely.
students have this point. See, they
Mm,
want to do
mm,
service, they want to help their
mm,
patients. Okay.
mm.
But finally, they have to feed themselves and their families as well.
Correct,
So,
correct,
a
correct,
financial part it plays a pivotal role in their decision as to whether to go ahead
correct,
with this career or not.
correct, correct. So you have to understand the fact that, like I mentioned, you play an integral part of that entire team. Okay, the final prosthesis that's made is made by you. So basically, the patient needs to understand that without your device, they will not be able to have a decent quality of life afterwards. So the amount you can charge for that can always be above market because you're giving them something that is not available anywhere else and no one else can do it. So you are actually putting yourself in a niche, and that gives you the capability to actually charge pretty well and give you a very good economic stability actually.
Understood. But as of now, you told me all these centers, like the teams which
Mhm,
are there, are in tier one.
mhm,
Now, imagine I've done
mhm,
my prosthodontics. I go and
mhm,
specialize in this,
mhm,
sub-specialize in this further, get into the
mhm,
super niche. How do I
mhm,
go back and find job opportunities or such kind
mhm.
of patients to treat?
Great question. So what you have to do is basically what I've done here also in a tier one city is that I have formed my own team. You have to go and find the people of the right mindset. The problem that we have in our country is that surgeons don't really like being told what to do. It gets very hard to dictate to a surgeon that sometimes this is required because I understand their standpoint. They're looking to save the life of the patient, so they are completely right in what they're doing. However, in the quest of trying to save the life of the patient, sometimes what is going to happen after the patient is living for the next 10, 15, 20 years is overlooked, and that is where you come in. So what has to be done is you have to find surgeons of the same mindset or a similar mindset, tie up with them and become a part of that team. And this will only happen in onco centers, in cancer centers, or then if you have that grit and the capability of doing it, start your own.
Got it. But now, as we know, we're getting into super specialty or a super niche, sub niche. Okay.
Mhm.
And we know there are very few people who are actually trained in doing it well. Okay.
Right.
So when I'm doing this, a young prosthodontist getting into it, I'm sure there'll be a lot of challenges he'll face and certain
Mhm.
complications also he'll face. So how
Right.
can he overcome that when he's just starting out?
So you're talking about from the case from treating patients,
Yes,
right?
treating patients perspective. Because he will get stuck
So,
in certain challenges and complications. How
right,
will he
right.
treat them?
So, okay. So now the biggest, in terms of complications, see, every procedure has its complications. Even implant dentistry has its complications. Any surgical field has its complications. Even composites have their complications. Okay, so we're always trained on how to deal with those. All right. So the complications here are almost the same. There's nothing really major. There's no life-threatening complication that's going to happen while you're doing maxillofacial prosthodontics. Okay, but the challenges that you will face are immense because every case is different. Because here you're not just dealing with a tooth, you're dealing with the entire musculature around, you're dealing with functioning swallowing patterns, you're dealing with aesthetics also if it's an extraoral prosthesis. So there are a lot of challenges that you will face in terms of treating the patient. How do you face them is that, of course, your skill set will come into play. You should be trained well enough to be able to face those challenges. And then, of course, you have the entire support system of the very few maxillofacial prosthodontists that are there. We're very welcoming. We're more than happy that there are new maxillofacial prosthodontists coming around. So we form a body. It's already there. And we discuss cases on that quite frequently. So that's not the issue at all. However, another challenge which is not seen is the emotional challenge that you will face, because you will be dealing with patients. If you don't have a strong stomach at looking at someone who's lost half his face while you're treating him, you will not be able to do this branch of dentistry. If you are not a fan of looking at blood, if you're not a fan of, looking at dead tissue all the time, this is not the field for you. And also to be able to deal with the emotional quotient of the patient, because these patients are mostly with cancer. They've already undergone a lot of trauma, emotionally, financially, mentally, and physically. So to be able to sort of have that barrier as a doctor and a patient, and also to be able to develop a sort of friendly relationship with that patient, is a very fine line, because here you're dealing with a different kind of mindset. No one listens to the cancer patients that much. They look at their doctors as their best friends because they can tell them almost anything. So you have to be able to have that amount of emotional maturity in you to be able to have those conversations with these patients and also be able to treat them, whereas keeping yourself away from it, because it takes quite a toll on you emotionally.
Understood. So
That's a big challenge.
yes, the challenge is the emotional part of it. Okay.
Mm-hmm.
And you should be okay with getting into the blood, seeing people who have lost half of their face and are in traumatic positions. Are there any other skill sets which is required so that if a prosthodontist plans to get into it, so that he has to be successful in it? What do you think will be specific skills he should focus on?
So that's the best part, that you're already a prosthodontist. Okay, because we're talking about, so one thing that I have to specify over here is that only go into the field of maxillofacial prosthodontics if you have a very sound prosthodontic and a prosthetic background. Your foundation with regular basic conventional prosthetics has to be bang on. If that is weak, you will not be successful as a maxillofacial prosthodontics, because all those concepts get challenged to a different level when you're dealing with maxillofacial prosthodontics. Okay, so that is something you have to understand. But if you're a good prosthodontist, you already know how to prep a crown, you know how to do your cast partials properly, complete dentures properly, you have adequate hand skill. Maxillofacial prosthodontics is just an aspect of a little bit of training. It's not rocket science.
Understood. So you're saying there is scope in it, and if you're willing to put in the effort and your basics are strong, you can get into it. So a prosthodontist has seen all this and is now ready and wants to take the lead. Okay. So are there any courses as such or any specific training to get him started in this field?
Okay, so for that, there are smaller courses that do take place time and again for mostly silicone, so extra oral prosthetics. Okay, but if you want to do a comprehensive program that will allow you to understand maxillofacial prosthetics right from the base up, we do run a fellowship program along with Smile USA. Okay, so this gives you a certification from the US as well. It's a 4-module program that runs throughout the year, where you will be handling cases both intraorally and extraorally. You'll be given an entire outlook as to the scope of maxillofacial prosthodontics as what we have discussed today. This usually takes place either in Bangalore or in Chennai. And I would highly recommend that this program is attended by prosthodontists, or like I mentioned, BDS students who have undergone small courses. They have honed their skills in crown and bridge work, in cast partial denture work. It is definitely something that they should get into. It's a diploma program, as a fellowship, sorry. So you definitely come out very well trained in the aspect of maxillofacial prosthodontics and prosthetics. So it gives you an absolute wide view as to what is supposed to be done. And then, of course, you should be a part, like I mentioned, then everything else in the background should already be there. If you should be a part of a cancer team, or you should be having that influx of cases, because then is the only time you'll be able to practice this. It is not as simple as crown and bridge, where if you've just done a few crown preps, you'll be able to repeat that all over. Like a premolar can be a premolar more or less. It's not going to change so much. But a hemimandibulectomy or a maxillectomy case, every single case is completely different. Every single case. So you should be able to manage that, and you'll only get that through practice. So that foundation of having basic pros knowledge, also you should be in a place that has that regular influx of such kind of patients, could be even trauma or could be cancer. And then I would say you should go ahead and do this course. It will be of great benefit.
Got it. So if someone wants to contact you and wants to do this course, how can they reach out to you?
So basically, my contact details are absolutely available. So you can definitely get in touch with me. I'll be able to guide you ahead, or the students ahead in that. That's not an issue. You can even check out the fellowship program online. There's a lot of information regarding it. So it is a Smile USA Maxillofacial Prosthetics Fellowship Program, which they can check out on the internet. We hold this as a yearly program. We just finished a batch now. The next batch is going to be coming up. We're just deciding whether we want to do it in Bangalore or in Chennai. We have revamped the entire program. The best part about this is it is hands-on. So it's not just us giving you didactics and lectures. You actually treat patients both intraorally and extraorally. Every single student gets his patient. The details are up on the internet, so it should not be an issue at all.
So what we will do is we'll be posting all the details on our Instagram page. And if you want to contact Dr. Reiyal, we'll be even putting him as a collab in our Instagram page, so you can find out and check him out there as well. My next question is, what is your advice? You've seen a lot of struggles, you've seen your growth throughout dentistry. So what is your advice to a young BDS who's graduating out there, or a young prosthodontist?
So for a young BDS, okay, I would say that first of all, don't go under the impression that you must do a master's in order to get better at your work. Nowadays, there are a lot of courses that will allow you to get that specific skill set that you actually enjoy doing. Dentistry can get very taxing if you're not passionate about it. So find what is your passion, and then pursue that, and then you will do very well for sure. In terms of prosthodontists who are already trained, you already have a very good grounding. You have your foundational knowledge there. If you're looking for something that challenges you every single time you see it, if you're ready to take on such cases, understanding that what you will do now is possibly going to dictate how that person is going to live for the next, his life basically, and you're improving that quality of life, that satisfaction that you get after treating a single maxillofacial case, you're not going to be getting even after doing loads of implants, composite restorations, anything. You literally, when you put someone's eyeball back into his eye or give him a ear again, and the look that he gives you is priceless. So if you're willing to take up that sort of challenge, maxillofacial prosthodontics is the branch for you.
Thank you. Thank you for explaining it in detail, sharing your journey with us, explaining what it is. So I'm sure a lot of prosthodontists who are seeing this would have their eyes open and realize there is scope out there beyond just basic prosto. Thank you, Dr. Reiyal, for your time today.
Thank you so much. Thank you so much, Dr. Sarish. Thank you. Absolute pleasure talking to you.
Same here.
Thank you.
If you like this video and are also thinking of what options you have after maybe oral surgery, you can check out these videos. If you're thinking how to be a better consultant, you can check out our other set of videos. I'm Dr. Satish Kumar. This is Tyson Dental.